All right, so again, good morning, everyone. Welcome to the January meeting of the Brooklyn TD Council. I hope everyone's doing well. We have a pretty big agenda today of updates from the council, OPWDD. IAC will not be in attendance, but Winnie sent me updates on their behalf as they're going through some staffing changes there. Maybe we'll have some updates from DOH, and then we have two presentations, one from David Krasner from Wellbound, and the other is on the IDD Ombuds Program that's been announced. There'll be a presentation. I think they'll be joining us sometime after 11. So with that being said, regarding the council, you guys should have received emails, and on our website, we are in the process of planning the 5-borough virtual legislative breakfast. It is coming up on March 6th. It's a Thursday this year. We're trying not to have any conflicts. There's a rally in the Valley on the 7th where we typically would have had it. If you didn't get it out, I'll send it out again. Registration is free, and the link is on our website. It's in the emails that you guys have received. Please sign up. Spread the word to your local elected officials and legislators and tell them how important it is. This is a really good event in regards to advocacy. All 5 boroughs come together and spread the message on what we're asking for in the field to make it sustainable, to support our staff, and ultimately support the people that we're serving. So if you have any questions about that, please reach out to me on the side and I'll get you any information you need. Marjorie, I think I saw you. Do you want to talk about your upcoming committee, Meaningful Day Committee? All right, maybe we lost Marjorie. But Meaningful Day Committee has a meeting coming up on Thursday, February 6th at 4 p.m. And remember, Meaningful Day is a new committee. It's a combination of a bunch of committees we had in the past: Children's Services, Transition, and Work, and really talking about Meaningful Day for the people we support, everything that goes into that. And that's also going to be the theme of what Brooklyn's covering for the legislative breakfast this year, because each borough has a different topic that they cover, and Brooklyn will be Meaningful Day and employment.
Hi,
Marjorie,
Brian.
is there anything?
I'm
Oh,
sorry.
there you go. No problem.
Sorry, I got called into another meeting. But yes, we're very excited that that committee is finally going to be up and running. We did have an initial meeting just to kind of set the stage and let people know what the committee was going to be about and the focus of the committee. So February 6th is our kickoff meeting to really go over some of the nuances that are happening right now in transition and across the span in terms of the Meaningful Day. So we're really excited and we're looking forward to everyone participating. Did you give everyone the date and time? I'm sorry, I didn't hear that part. It is
Yeah, Thursday,
February.
Thursday, February 6th at 4 p.m.
Yes, thank you.
And the flyer was sent out. I believe the flyer is posted. If not, I'll post it again on our website, social media. And I'll send it out again as it gets closer.
Yes, thank you.
Although it's next week, so it doesn't get much closer. Can't believe it's February already.
Yeah. Insane.
All right. And I did see Lucina, but it looks like she left her desk. So I wanted her to give a quick update on the legislative committee. There was a really great meeting, a special meeting for the legislative committee last Thursday as a follow-up from the governor's budget update. Rochelle, I hate to put you on the spot, but I know you were there. Do you want to say a few words about it?
Okay, Brian. I guess Maria's not here either. I guess not. Okay. So basically our focus now is to, of course, support the efforts of NIDA's demands and organize with our legislators about that. But one of the most effective ways to do that is to get more legislative participation in the upcoming breakfast, where they can get a better sense, a more detailed sense of the needs of our community, the breadth of our community, and learn about the faces and the people, and not just, talk about people with disabilities as a group. And so we're really going to be doing intensive outreach to get legislators to attend the legislative breakfast And also, we have a few in line to speak at our section of the breakfast. But the most important thing is to get people to attend. So we are looking for people to help with outreach calls to the legislators. We're going to be doing a mailing to them this week, and then we need to do follow-up calls because, you know, emails get lost in the shuffle unless you call them and then you have to resend the email and get a commitment from them, put it on the schedule for the legislator, et cetera, and get a commitment for them or a key staff member to attend. So if anybody would like to help with the outreach calls, we would be very grateful. And you can contact Maria, who I see now is on the meeting, or Lucina or myself, and we'll plug you in.
Yeah, and if you contact any of us on the council, we'll make sure it gets to the right person. So don't worry about getting to the right person. We will help you get there. We do have a spreadsheet where we're marking down who's contacting who to try to keep it organized. Not that it matters if we all contact the same people and let's overwhelm them with our invites and our requests to join. That can't be a bad thing. Thank you, Rochelle. Maria, Lucina, any other information you want to add regarding the legislative committee?
Thank you so much. Rochelle has been doing a great job in doing that. I was away for a bit. And we are really looking out for outreach. If you have a good contact with one of your representatives, whether it's local, federal, or state, let's all reach out. And just make sure as providers, make sure your parent contact list or your individual contact list is up to date so you can make sure our individuals are also on that virtual call on the day of our legislative branch. Because we want to see the individuals, we want them to say hello, we want the representatives to see them. So that's what we're doing as far as outreach. The more we overwhelm them with emails, we're doing our part as getting the contacts who we may have relationships with. So thank you so much. So according to Brian, you can contact any one of us, send to him an email. So if you have a representative who would love to show up on the Zoom, please don't hesitate to assist. We always need assistance. And also, if anyone is interested in being on the legislative committee, you know, we meet on the third Wednesday, you know, at 11. So join us. I mean, we always need more ideas, more support. The more we all understand how important it is to contact our legislator, not only when time for their voting, all around, not when we want something. Let them know that we exist and our individuals with a disability exist. So thank you all. Maria, anything to say?
Yes, just to add, I don't know if it was mentioned before, if you have connections with legislators that are even Republican, please invite them. We need both sides of the aisle to be at this meeting. So Democrat, Republican, Independent, or in between, please invite them to the legislative breakfast. And also, I know Brian had sent out a list of where we have residential or services for the DD throughout the borough. If you have that list, you will know who the legislators are, and you could give them that information. We have 10, 20 sites within your district. So that information is very, very valuable when you're speaking to them. So you can let them know that we do have individuals and families that live in your district that are expecting your support. Thank you.
And if anyone is willing to help contact elected officials, we do have like a form we created. So you don't have to think or come up and create anything. We do have a letter on behalf of the council to formally invite elected officials. So we can share that. And it has Maria and Lucina as the main contacts to get back to if they're interested in attending. If anyone does reach out, the other thing is because it's the 5 boroughs joining together, there is a bit of a time crunch in terms of how much each borough can present. So we can't promise that every elected official that will join will be able to speak during the meeting. But if someone is interested and expresses that concern to you, please let us know because we're always looking for people to participate. All right. Debbie, you have your hand up.
Yes, first, I thought the legislative meeting is going to be on the second Wednesday on February 12th. It goes after the Family Information and Provider Information Committee.
Thank you, Deborah, for correcting. I thought it was the third. Thank you.
Yeah, I wanted to make sure because we do need everybody to come. Though since Rose is not here, I'm the co-chair for that committee. And we did meet the we met on January 8th, and we had Care Design do a fantastic presentation explaining to families how to get how to get a care manager and what services there are, what to do in case there are issues or problems. They did a great presentation. If you want to present at that our meeting, which will be the next one, will be Wednesday, the 12th, you can contact me, Deborah Greif, at bfssac@yahoo.com, or Rosal. I don't have her exact email at the moment, but she will be we were looking forward to hearing anybody who wants to do a quick presentation. We meet from 10 a.m. to 11 a.m. and then goes right to the Legislative Committee, and it will be on Ring Central. Can I just do the Advisory Council quick to get it over?
Sure.
Thank you. All right, the Advisory Council's last meeting, we spoke about issues for legislation and what's going on with the statewide committee. Due to the fact that in February, when we usually meet, we it's going to be it'll be school vacation, but there is going to be a multi-borough advisory council meeting. We will also have the ombudsman from New York State for OPWD, but the New York City region will be there, and it's going to be on Thursday, February 6th, from 10 to 12. The next day will be the Advisory Council's mini resource fair, which will be at the library up in Greenpoint. We do not have any tables left or open, but if you have information you still want to bring to us, you still can come, give us your information. We put it on the information table, and Carrie Banks from Inclusive Services always shares it with everybody so that you can do that. So we just want everybody to remember that. Also, remember that the multi-borough will be on Zoom, and it is on the Advisory Council website, which is www.bfssac.org. And also Brian put it on the Brooklyn DD Council's website. So we hope we see everyone there. Thank you.
Thanks, Debbie. Any other council committees I missed? We got the meaningful day, we got provider family information, we got legislative. I think that's it for now. All right, so at this point, I think we can move on to Nina, who's here from OPW to give their update.
Good morning, everyone. And I guess I can still say Happy New Year because I haven't seen this group this year. So I'm going to start with some updates. As you know, several weeks ago in State of the State address, Governor Hochul unveiled a broad policy agenda for 2025 that includes proposals related to our system. Governor announced a creation of regional disability clinics. As you know, people with developmental disabilities have the same healthcare needs as people without the disabilities, but often experience lower rates of preventative screening and higher rates of disease. To expand access to competent and accessible healthcare for people with IDD and their families, Governor Hochul will provide funding to create regional disability clinics across the state. The funding will support one-time costs that increase accessibility and improve quality of care. Through these investments, people with IDD will have access to more trusted and more qualified providers for their medical needs, and capital grants for this one-time investment will be awarded by OPWDD in consultation with Department of Health and will be used specifically to increase access to medical care for people with IDD. Governor also announced the strengthening of the Workers with Disabilities Employment Tax Credit. The Workers with Disabilities Employment Tax Credit support businesses who hire people with disabilities by making it easier to implement reasonable accommodations for workers with disabilities. Governor Hochul plans to more than double the maximum tax credit from $2,100 to $5,000 and simplify the process to increase the number of businesses who can successfully welcome employees with disabilities. The next proposal is Governor Hochul's investment of $75 million to modernize the Institute of Basic Research. This investment will include the establishment of genomics core facility to allow for customized identification of genetic defects underlying people's disabilities. In addition to Institute Basic Research renovation, the funding includes the transformation of Willowbrook State School property into a center of learning to recognize the historical significance that former residents of Willowbrook and their family advocates had in sparking New York State's disability rights movement and on influencing the DD delivery system nationwide. This is the largest single investment and financial commitment to Institute Basic Research since its opening in 1968. Governor laid out a proposal to support mobility for people with developmental disability. We will be increasing wheelchair access for Medicaid members by increasing rates for clinical specialty evaluation for new wheelchairs, expanding coverage for repairs of previously owned power chairs, and expanding coverage of routine and preventative maintenance for wheelchairs, which will help costly breakdowns and minimize downtime for users and extend the lifespan of the equipment. These changes will support the mobility, health, and independence of people with physical disabilities and remove avoidable barriers to necessary medical equipment and solidify Hochul's commitment to creating a more inclusive environment for all New Yorkers. Now I'm gonna quickly mention about the rates. In late December, OPWDD providers were notified that the funding that was included in fiscal year 24-2025 budget was approved to update reimbursement rates for nonprofit residential and day service providers who are licensed by OPWDD, retroactive to July 1st. The new rates ensure that OPWDD service providers have sufficient funding to provide high quality services and offer more competitive wages, primarily to those who are engaged in the front lines for direct support activities. The enacted budget provided $130 million of state resources and a total of $350 million when combined with federal funding, and to update the rates as part of 2024 rebasing. As part of the rate update, the state has also invested additional resources that will leverage almost $500 million more in funding than what was initially earmarked by the final budget, bringing the total increase to nearly $850 million to our providers. I can quickly mention that the RFP, I'm moving to the next, for home enabling supports went out, and the applications were due last week, January 20th. So OPWDD will be working on selecting a provider who will be delivering home enabling supports. And lastly, I'm going to mention about National Expansion of Employment Opportunities Network grant. In December, the U.S. Department of Labor announced that New York would be one of the 13 core states in fiscal year 2025 that will be participating in National Expansion of Employment Opportunities Network. This initiative will enable government agencies to receive capacity building support, policy development assistance, and ongoing mentoring to increase competitive integrated employment for people with disabilities. The initiative collaborates with state agencies and providers to increase the employment for the people who serve through provider transformation. In New York, the provider transformation process realigns disability service provider agencies' business models to provide the full array of employment and vocational services to increase employment outcomes. Initiatives also include new revised memoranda of understanding with the other New York State agencies to leverage and sequence employment services, benefits planning use as a state as a model employer and state strategic planning. And NEON initiative works with grantees to increase competitive integrated employment for the individuals they serve, including those with significant disabilities and those who have faced barriers to employment. Currently, they provide technical assistance to 5 grantees using a pool of national subject matter experts who serve as peer mentors in provider transformation and customized employment. They also provide a one-to-one technical support and an opportunity to network with other grantees to learn about effective strategies through peer-to-peer mentoring. So that would be all for me for today. Any questions?
Thank you, Nina. Does anyone have any questions for Nina? Stephen, were you trying to ask a question to Nina?
You're that.
I'm sorry, Stephen, you keep breaking up if you are. It looks like you're frozen now. Doris, you have your hand up.
You're muted.
Second. Okay, now you hear me. Nina, I just have a question regarding the creation of disability clinics. If you have more information about that, it's going to be specific for the ID population. It's not going to serve typical. It's just going to be
Specific
exclusively for the ID. And also, you said across New York State. I hope New York City is getting a lot more. You know, we have a lot more people here. Like, how's that? If you have more information about that.
So
And when is that going to happen? I think
well,
our families would like to know that.
hopefully this year, but I will take your questions because I do not have the specifics.
Okay, I just want to add, like in Manhattan, with the closing of some hospitals, the need has become very great in some parts of Manhattan, and
we
this
hear
would be
that.
very helpful.
Excuse me, I'm kind of looking for work too, but I wanted to ask a
Thank
question.
you.
Why are you letting other people get jobs and not with people with special needs?
We are working with other way of working with our OPWDD providers to increase employment opportunities for the individuals. I can connect, Stephen, we can connect you after this call with someone from the regional office who can answer your questions if it specifically relates to you.
All right.
Let me check if Lucy is on from the regional office, if Lucy is on this call. Yep, Lucy is here.
And Doris, just to touch on the question you asked Nina about the regional disability clinics. So in the governor's executive budget, she included 25 million in capital funding to support the development of these clinics. And from wording from the budget, and this is part of the update that Winnie had sent me that I'll share when you guys are done with questions for Nina, but it'll support one-time costs for building modifications or equipment designed to increase accessibility and improve quality of healthcare for people with DD who access services in clinics licensed by Article 28 and Article 16.
Thank you. Thank you, Brian.
No problem. Nina, I
Thank
see
you.
we have one more hand for you as well. Carrie?
Hi, thank you. I just have a quick question. Actually, two, as it turns out. One, are the clinics for people with IDD of all ages? So that will they be for children as well as adults and seniors? And secondly, is there a particular focus or mandate for them to be able to provide services in multiple languages?
If there is a mandate to deliver services in multiple languages,
Or is that addressed in any way in the funding?
Carrie, I'll have to find to follow up on this.
And
Thank you.
And what about children? Will it be serving children, adults, and seniors?
I do not have the specifics.
Okay.
Harry,
But we'll-
most of the clinics do serve children as well.
Yeah.
Yeah.
If they have access to the Article 28 and Article 16, it would be the same access. I mean, in the executive budget, it was broad, and we know we'll find out more when everything becomes official.
Mhm.
And then it rolls out for 4/1 in New York State. But the way it was worded from the update that I saw is Article 28 and 16. So I don't think it's going to
Good.
differ by age as long as they have the approvals in those clinics.
All right. Thanks.
All right. Let me just check the chat. Yeah, Nina, I don't think there's any more questions for you.
Thank you,
So-
and I'll try to bring more answers for the next meeting.
Appreciate it. Or if you find out and want to send it to me, I can blast it out to the group if it makes it easier for you.
Yep. Okay, will do.
Thank you so much for your updates. All right. So like I said earlier, unfortunately, we don't have a rep from IAC here today, but Winnie did send me some updates. A lot of them were covered by Nina, so thank you for that. Saves me. But so one of the reasons that we don't have someone representing them today is, as we mentioned, I think in our December meeting, both Richard Bosch and Chris Trieber have left IAC at the end of December. That was official. Richard has retired, and hopefully he'll be one of the few that retire from the field and actually retire. And Chris has joined AHRC in advocacy type role. So IAC will be bringing on 2 new staff members. I believe one was hired already and officially announced.
Excuse me, I have a question to ask you. Do they do HRC? Because my girlfriend is in HRC, but they're not really doing anything for her about finding jobs.
So Stephen, I would just suggest reach out to AHRC directly, where I'm not affiliated with them.
What are you
But
affiliated with?
So I'm the chairperson of the Brooklyn DD Council, and I work for a company called Heaven's Hands. So the Brooklyn DD Council is just a place for people, individuals, families, agencies to come and gather information and share information.
Okay,
But there
I'm
is
so
someone.
sorry.
No, that's fine. I'm glad you're asking questions. There are people from AHRC on this meeting that I see one has messaged you. Maybe you can connect and talk offline with her to get your specifics. She put her email in the chat.
Which way do I go to her? Do you know?
Do you see the option to pull up the chat?
Hi, Stephen. My name is Pilar Jones. I work with the HRC.
Yes, I have a question for you.
Sure. Do you want me to
my girlfriend goes to HRC. They're not really helping her to get a job anywhere, and I was wondering, do they like have volunteer sites where she could go for now that could help her get a job, or
I'm
like
sure
an
we do.
internship, or
Yeah, I'm more than happy to help. This is a big meeting. We have a lot of people. So I put my email address. I can put my phone number in the chat also. And you could give me a call and I can get a little bit more information and try to connect you guys to the right person.
Okay. Thank you
Okay.
ever so much for your help. And please give me information, please.
No problem. My email is in the chat and I'll put my phone number too.
I'm just sending it to my email. I'll give you my email. It's Steven.
Okay, Steven, I put my email in the chat. So you just email me, okay?
All right.
Okay.
Thanks, Pilar. Thank you, Stephen, for asking your questions. Okay, so IAC was in the process of hiring 2 people to replace Richard and Chris, and I believe they did hire and announce their VP for Children's Services, and that was Kate Hoy, who has been very involved in a lot of the council meetings. I believe she's very involved with the Queen's Council, and their Children's Committee, and I don't believe they've announced their VP for Adult Services yet. So as soon as we get that information, you guys will likely meet them on one of these meetings, and we'll send that information in the email. Now, I just want to quickly see what wasn't covered that Winnie sent out. So I think at the end of the year, OPW released their strategic plan update. It is on their website. It includes short-term housing strategy, things that can be accomplished in the next 12 months in response to feedback from all stakeholders. New York State's Chief Disability Officer is hiring a Director of Employment First. Community Services Society of New York administering new Ombuds Program for OPW, and isn't that great? We're going to have a presentation later on in today's meeting from Rachel Schumann, who represents that program. So you guys will get all the details. There is a new housing ADM for certified residential opportunities that was released in conjunction with the new IT platform that will streamline and improve the placement process. Desk reviews will be conducted for self-directed service recipients where FIs, fiscal intermediaries, have approved community class utilization volume resulting in billing of over $24,000. And again, I apologize as I go through this. I don't have all the details. I'm just kind of giving the update from Winnie at IAC. OPW announced, I think 2 months ago, emergency preparedness regulation requirements for providers and a template and training on how to complete the emergency preparedness regulation requirements is being planned, and there will be more information to follow. There will be a webinar on the 30th, I believe that's Thursday, on Fatal 5 and the medications that affect them. In regards to DOH news and early intervention, last year's state budget's 5% increase for early intervention will finally be included in rates, but retro to 10/1/24 rather than 4/1/24. There will also be a 20% decrease in early intervention's telehealth reimbursement. Advocates are collaborating to determine the impact of this reduction. There was also recent coverage by Newsday on the inadequate funding of early intervention, and the reporter plans to do another piece on the issues surrounding the early intervention hub. In advocacy efforts, the state of the state from the governor was last week, and there are a few updates later on regarding what she said and what we think is included in the budget. NIDA held legislative roundtables. A series of virtual roundtables were held with legislators across the state to discuss OPW budget requests developed by NIDA, New York Disability Advocates. Legislators asked good questions, gave good advice, and didn't think any of the asks were out of the question. So the asks that NIDA put together for our field were a 7.8% rate increase, a wage commission to study adequacy of frontline staff salaries and make recommendations for a plan to raise wages to sustain them and the system, and include OPW providers in funds available to make environmentally sustainable capital improvements. IAC's lobby days will be February 11th and 12th in Albany for all budget areas, OPW, SED, DOH, and May 6th for SED only. More information has been distributed, and if you need any additional information, you can email anyone at IAC or you can email me and I'll try to get it for you guys. Whole Person Supports Coalition update. I believe I did a brief training on that in December's meeting, if I remember correctly. So this is a statewide initiative involving all stakeholders to transform the system of services and supports so that timely services are available to all who need them. Advisory and steering groups have been formed and have had preliminary meetings. And you can stay updated by going to wholepersonsupports.org and signing up for their newsletter, where they will keep you in the loop of meetings and what their plans are. And then the DSP Sustainability Project. IAC is working with Dr. Jen Cohen, who authored a survey on the lives of DSPs as whole people and how we can better support our frontline staff. The project will build a series of trainings, workshops, and other events that will help our agencies to become even more supportive workplaces. The steering committee has met 3 times and will soon be previewing the first of the workshops that they hope to expand beyond IAC and to the entire field. While we continue to advocate for better wages, there are other measures that we can take both individually and collectively to help DSPs so they can continue to support the people in their programs and their families who rely on them 24/7. IAC will be releasing more information on this project soon that we can share publicly. All right, back to New York State budget updates. So again, on the 21st, Governor Kathy Hochul released the executive budget for state fiscal year 25-26. The plan included $252 billion in total spending for fiscal year 26, representing $8.6 billion increase over fiscal year 25. Notable revenue actions within that executive budget: $850 million in gross annualized funding to help OPW nonprofit providers increase wages for their frontline workforce, what they call invest in new service opportunities. Invest new state resources, $30 million in fiscal year 26, $60 million annualized to fund OPW priority program reforms and new service opportunities that enable individuals to receive the support they need. This includes individuals who are entering the OPW service system for the first time and individuals already receiving services, but whose needs have changed. These state funds leverage federal resources for a gross increase of $120 million annually. Also in the executive budget, she is committing an additional $15 million to develop housing. The executive budget continues to expand independent living opportunities for individuals with IDD. These funds are distinct from and in addition to resources that are available from the 5-year, $25 billion affordable and supportive housing plan, which is also helping support the development of residential opportunities for people with IDD. Ensure stable housing for vulnerable population. ESSHI rates will be increased from $25,000 a unit to $31,000 a unit, with an additional $3,000 for units in the New York City metro area. And this funding will be increased by more than 40%. For education, the executive budget provides $37.4 billion in total school aid for state year 2026, the highest level of state aid in history. The investment represents a $1.7 billion or 4.7% year-to-year increase, including $1.5 billion or 5.9% foundation aid increase, and $230 million or 2.1% increase in all other school aid programs, including expense-based aids, categorical aids, and competitive grants. There was also a one-time targeted inflationary increase for fiscal year 26 at the rate of 2.1%, typically refer to that as a COLA. So there is language for a 2.1% COLA in the budget. It will authorize additional financial support to assist not-for-profit providers with increasing costs. The bill would require local government units or direct contract providers to account for their use of the funds and would authorize agency commissioners to recoup funding not utilized consistent with statute or appropriation. There was in the budget, extend the workers with disabilities tax credit for 3 years. The bill would extend the workers with disability tax credit for an additional 3 years through tax year 2028. The credit provides tax incentives to qualified employers for employment of persons with disabilities. It is currently available through 2025. Permanently extend committee on special education financing structure. This bill amends Section 3 of Part N of Chapter 56 of the laws of 2020 to remove the April 1st, 2025 sunset and make these provisions permanent. It eliminates the state share for residential placements made by a school district outside of New York City and increase the school district share by an equal amount. This chapter also shifted the 50% state share for certain placements to the New York State School for the Blind or the New York State School for the Deaf to the school district. These changes better align fiscal responsibilities with the entity that makes the placement decision and provided parity with New York City's funding structure for CSE placements. All right, I think that covers what wasn't covered by OPW.
Can you
And again, I apologize for, go ahead, there's a question?
can you reread the last piece on the special education
Financing structure?
commission?
So it says this bill amends Section 3 of Part N of Chapter 56 of the laws of 2020 to remove the April 1st, 2025 sunset and make these provisions permanent. Part N of the Chapter 56 of 2020 eliminated 18.42% state share for residential placements made by a school district outside of New York City and increased the school district share by an equal amount from 38.42% to 56.84%. This chapter also shifted the 50% state share for certain placements to the New York State School for the Blind or the New York State School for the Deaf to the school district. These changes better align fiscal responsibilities with the entity that makes the placement decisions and provided parity with New York City's funding structure for CSE placements.
So the overarching question then is, what if the district doesn't have the money?
Yeah, I'm not sure. The good thing is, though, we have 2 budget briefings planned by IAC and Winnie. I sent out emails for them, so I would say maybe in advance, email her that question because maybe she can address it when she does her budget briefings.
Thank you.
And that reminded me, I didn't say that earlier when we gave our updates. So the budget briefings that I emailed out, there is one scheduled by IAC for all the councils that can attend for free on Friday, February 7th at 10 a.m. And there's another one on Friday, February 14th at 12 p.m. Both of those links are on the calendar on our website. Anyone is welcome to register to attend. They're both held via Zoom, and when it will be going into more detail as everyone has more time to digest the hundreds of pages of budget that the governor throws at us to try to confuse us and mix in all the good with the bad. It only took till page 109 to find out we were getting a 2.1% COLA for OPWDD. All right. If you do have any questions, you can certainly email me. I'll pass them to Winnie because it won't be any good for me to try to answer them for you. She's way more knowledgeable in this. I was just reading her notes, but I appreciate you making it through that and still being awake. Rochelle?
Yeah, thanks, Brian. It's not a question exactly. One comment, if you're going to read the budget for our stuff, it's best to read it from the end, from the back to the front, because we're always at the end. So you'll save time that way. The question, it's more of a comment, which is that I really hope that people will start thinking more about the federal budget advocacy as well. We are facing, to put it mildly, very uncertain times with this new administration in terms of Medicaid funding and all sorts of entitlement funding, including SNAP. There's already been proposals of, putting in work requirements for Medicaid coverage, which wouldn't affect, we don't think, our population mainly, but also for SNAP. And that will drive many families into food insecurity if they lose those benefits. But there's been a lot of talk about the new federal administration rolling back some very significant benefits for our population, such as the federal match for waiver services, rolling back the new managed care tax, which is being used to fund some of the enhancements that the governor has proposed, and many other dire things. None of that is certain, but we know that at a minimum, we're in for some rough times. I know that Brian has sent out the materials from Anchor. I'm hoping maybe you can distribute it again, Brian, to the council members, but we really, really need to start participating with advocacy on the federal level as well as the state, because we could win on the state, but if the feds take our money away, whatever we've accomplished is gone, and we will be in much, much, much worse situation. I don't want to sound like Chicken Little, but I think it's time to sound like Chicken Little.
Yeah, it's never a bad thing with everything they're telling us. And it seems like more and more power has gone to the federal level in everything that goes on with our funding. So it's not a bad plan, Rochelle. All right. No, because I went through the IAC update, I lost my place of where we were. I think we're up to, there is no update. We appreciate Rihanna being here from DOHMH, but she does not have an update for us today. But thank you for attending and listening, and hopefully bringing back some of this information to your office with you. So I think we're up to our first presentation. So as I said earlier, we have two presentations today. So the first presentation, we have David Krasner from Wellbound. David, are you still with us?
Yes, I am.
All right. So the floor is yours.
Happy Monday, everybody. I know the weekend wasn't long enough. But I'm here to discuss the special needs services that we provide here at Wellbound for Special Needs. I'm the VP of Strategic Partnerships, Special Needs for Wellbound. I'm going to discuss our services and we'll go from there. I'm going to share my screen. Oh, can I share my screen, Brian?
Yes, let me just make you co-host. You should be good now.
So here at Wellbound, we provide therapy services and home care services in-home, home health aid, OT, occupational therapy, physical therapy, speech therapy. We have where we differ from a lot of agencies is that we have our own therapists. We have our own home health aides that we send to the home. So we provide the care and therapy that your clients need. Wellbound for Special Needs offers expert at home and therapy services. So as a care manager or even as a qualified intellectual disabilities professional, a QIDP, you guide your clients in allocating their budget, submitting documentation, and finding local community-based services that are a good fit for their needs. The most important part of your job is to set up their most cherished resources. What I mean by that is their daily care providers and therapists. These are daily services that the client is receiving, as opposed to respite, which is maybe a couple times a month, or other services that are less frequent. Wellbound for Special Needs is the partner that you're looking for. We share your mission in providing care for special needs community here in New York, specifically in New York City and the 5 boroughs, New York City and the 5 boroughs, New York City and Long Island, Nassau and Suffolk County, which is our coverage area. Wellbound is here to service your needs. We're set up in a way that you can provide your clients with expert care services with confidence, of course. Work with an agency that shares your goals and passions. Communicate with our intake and patient advocacy team, and stay updated on the progress of your clients. So who we are. Wellbound is a person and family-centered agency dedicated to providing a stronger standard of more attentive care to the adult and pediatric special needs community. At Wellbound, we are committed to providing the care patients need, whether it's registered nurses, home health aides, ABA therapists, occupational therapists, physical therapists, speech therapists, all under one roof. So at Wellbound for special needs, we provide comprehensive specialized home care services. Our specialized home health aides provide our patients with after school and weekend hours, personal care and support while assisting them with their daily activities and relieving the stress that comes with special needs care. So we also offer goal-focused therapies practiced by licensed therapists, ABA therapy, speech therapy, occupational therapy, physical therapy. Again, we hire our own therapists. We no need to outsource for us. We have our own therapists that could come to the home that we employ ourselves. The Wellbound difference. At Wellbound, we know that working together to create happy and healthy families is the key to long-term care success. With open communication and trust, we develop care plans that take the entire household and the whole patient into consideration. Combining integrated teams and modern technology, we develop the care plans that coordinate specialists for optimal well-being, ease the stress and burden of special needs care, and help the families that need it most. So speak to our dedicated patient advocacy team or our intake team today to discuss getting the right care for your clients. Here's our contact information. I also shared my contact information in the chat. And now I like to keep my presentation short and keep the question and answer sessions and discussion a little bit longer. So here I am to answer any questions about our services. Any questions?
Thank you, David. Any questions for David? And if you could, okay, I can see it now. I was gonna say stop sharing because I couldn't see if people had their hands up, but I don't see any questions as of yet.
I know I guess I could go into a little bit more detail from the presentation. So what we specialize, we help families, we help children get onto OPWDD. We help them, we assist them with getting the psychological, psychosocial, and referring them to a CCO or the front door CCO, whatever the process is. But we're only licensed to accept people with individuals with code 95. So as long as an individual has code 95, which is OPWDD waiver, we could provide home care and therapy-based services. And if they don't have code 95, we could help them go through the front door and eventually find a CCO. But they don't need CCO, and they don't need a CCO to get our services. They just need the code 95. If anybody's shocked that I'm with Wellbound, I used to work with a company called Hamaspic Home Care. In case you did a double take, it's true. I'm now with Wellbound. Any questions? Any home care questions? I've been doing home care for March will be 8 years. I've been doing special needs home care. I've been doing special needs home care, specializing in that field since March 2017. So I was out of all the people who do OPW home care for the OPWD population, I've been doing it the longest by far, and I've been thank God I've been able to help a lot of families and a lot of individuals get the services that they truly need.
Question.
Sure.
And you only focus on children, right?
Children and adults. So basically,
okay. So you can assist adults.
We could assist both children and adults with either therapy or home health aid services. The difference between Wellbound and, like, for example, company that begins with an A. I'm not going to mention any names. We don't we don't make the families. We don't push the families into home health aid. We could offer standalone therapy services. So
Okay.
offer this if the patient needs just speech therapy and physical therapy and occupational therapy. We could offer those standalone services. No need for HHA, but if there's an HHA, if there's a home health aide already in a home with a different company, two certified home health aide agencies cannot be in the same home at the same time. So basically, we can provide those standalone therapy services, but as long as another agency is not already in the home providing home health aid, the
All right.
person
I'm sorry.
has to
Let
opt for
me.
home health aid, but we could provide the standalone therapy services. But the person doesn't have to get home health aid. But if the person's already receiving home health aid and there's another agency billing in the same home, there's an issue with that.
All right. Let me narrow my question.
Sure.
I'm asking in reference to getting OPWDD services because I do in my office, I get quite a lot of adults asking about getting OPWDD services. And some I can refer them to front door but sometimes it's difficult for them to navigate. So would your company be a resource to them to assist them? Should
Yeah,
I refer them to you if I get the calls? Because I do get a lot of, especially adults looking for housing. And then when I ask certain questions, if they receive services from OPWDD, they would say no, but they are able to, so I just wanted clarification on that. So I guess moving forward, I'll just provide your information to them.
Sure. Yeah. I mean, we can assist adults, both children and adults, with getting, the code 95 attached to their Medicaid. But as long as they're looking for services with us, because we're ultimately looking to assist them with home care services. So as long as they're willing to get therapy services eventually and home care services with us, we can assist them with the OPWD, no problem.
Which ultimately they would, because most of them, although they are independent to an extent, they would need some sort of home care ultimately on the back end.
Yeah.
So it would be a win-win for everybody. Sure. All right. Thank you for.
Yeah, my pleasure. Sorry for cutting you off. I'm sorry. I can't see your face, so it's hard to see when you stop talking. My apologies.
David, are you guys, I know one of the biggest issues people have with getting services and getting eligibility are the evals, and you talked about the evals. But the last part, I just have to question that you just brought up, that you're willing to assist as long as they're willing to come to you for home care.
I mean,
are you willing to assist someone get evals to obtain their evals to get into services if they told you flat out up front they're not interested in home care, but they're struggling to get evals?
It's a good question, but let me scale back a little bit. We could help them. We could point them in the right direction, but in order for me to have our patient advocates allocate their time to that, it would need to be worth it for them to assist with other services as well. So I mean, we could point them in the right direction, but to actually take our time as a company to handhold throughout the process. I don't want to come up the wrong way, but
no, it's pretty clear. It's okay. It's pretty clear. Debbie has a question for you.
Sure.
Let me put it to you this way. David, hello.
Hello.
David, what happens if the family lives with their grandmother? The individual has the developmental disability and the grandmother's the senior, who gets her own health home aid. And it was now set up that the child who may need also the home health aid, but because of the developmental disability, they now allow two Medicaid services in the house at the same time. You didn't say that. So if a child has a developmental disability and goes under a different agency, technically say yours, but the adult who's a senior without developmental disabilities, they have been allowing them in the household.
I don't see a problem. Honestly, I don't see a problem with an individual under the OPWDD umbrella getting a home care aide and having a senior getting a home care aide in the same home. It's two different patients. It's not even a mutual patient with the same insurance. It's one through Code 95 and one through basically managed long-term care, MLTC. So that shouldn't conflict. One thing I wanted to mention is with all the CDPAP changes coming April 1st, 2025, where there's going to be a single FI called PPL.
Yes, I'm aware of that.
Yeah. So we are recommending more and more families to go through the home health aid process. Again, we provide silent therapy, but if somebody wants CDPAP, we could provide training to the family members not living in the same home.
And they cannot be
The
the
parent.
rep payee. If the person is, because you do not, the mother or father does not have to be the rep payee. You can be assigned to someone else to do the rep payee. But a rep payee is not allowed to do CDPAP.
Right, but I'm talking about HHA service. I was focusing on the
I know,
HHA.
but I want to make sure that everybody knows that. If you are a rep payee, you cannot do CDPAP to your own child. Even if your
Actually,
child lives in another house, if you are the rep payee, you're not allowed to do that.
so actually CASA and the DOH would disagree with that.
No,
HRA,
they're the ones who told me. Not
that's
the other
that's
way.
All right,
I know my stuff.
Debbie, maybe you
We're
can
not
touch
gonna
base with David offline.
another time,
And
David.
yeah,
But
yeah, sure. I'd be happy to. The CASA change
considering
that
they
rule.
told me what we can do and what we can't. Well,
Yeah, no, I'm not looking yeah, I totally understand. I'm just trying to educate everybody that that I wasn't here to talk about CD. Okay. Any other questions I can answer? Any other questions I can answer regarding home care services?
yeah. And if you don't have questions now for David, you can definitely send them to me. And I'll get them over to him. And I shared out all his flyers. They were on the site on the link. So we can make sure you'll get answers to what you need. But thank you, David, for your presentation, and thank you for being here. You've always been a big supporter of the Brooklyn Council, and we definitely appreciate you.
Thank you so much. Yes, Lynn?
Just wanted to clarify, so HRA might have told you, Deborah, that rep payee, but what they meant it was designated representative. Doing
Exactly.
CPAP has a specific role called.
I understand that, Lynn, but I was told no way under any circumstances could I be my own child's CDPAP worker.
And they are
said
wrong.
to me,
And I will send you.
I'm not wrong. I
No.
went through all this training.
The person who told you that.
Okay,
is
I'll tell
wrong.
Maria Ortiz Cruzada.
We will get you some documentation that clarifies that. Even guardians can be the paid worker as long as they find someone else to be the designated representative.
So basically what CASA requires is 2 designated representatives and 2 personal assistants. They can't overlap.
I'll tell Medicaid I'll tell Medicaid in the state that everything they told me was all wrong.
All right. Again, guys, Debbie, please just talk to David, talk to Lynn
Sure.
offline.
I didn't mean to make it a big deal. I'm just trying to. I've been doing.
That's fine. I'm glad to.
For a while.
I want people to connect and get the support they need. But that's an individualized issue, and I don't think, Debbie, necessarily you want everyone hearing your individualized issue. You want to deal with that where you can have open, honest conversations.
But they did tell us one thing, and I'm not going to disagree with the persons who told me.
Okay.
Sure, Debbie. I posted my phone number. You can call me anytime. I'm happy to discuss this with you.
All right. Thanks again, David. Appreciate the presentation.
My pleasure.
And next up, we have a presentation on the Ombuds Program. As I talked about earlier, we have Rachel Schuman from the IDD Ombuds Program. And Lynn, will you be joining her as well?
She's gonna present, I'm just listening, and I'm gonna look up the policy I was referencing earlier.
Gotcha. I just didn't want to ignore you in the introduction because I saw your name had the Ombuds Program under it also. All right, so I'm going to pass it over to Rachel, who's going to answer all the questions. I know there's been a lot of confusion regarding what is the IDD Ombuds Program that's been talked about. So Rachel, do you need me to give you co-host to share anything?
Yes, I do have a slide deck. I promise it's very short, but I find that having something visual to look at while talking can be helpful.
All right, I just made you co-host. You should be good to share.
Okay, great. Okay. Can you see my screen, Brian?
Yes, we can.
Cool, great. Good morning, everyone. Again, my name is Rachel Schumann. I'm gonna do introductions for myself and my colleague, Lynn, though many of you know Lynn, I think, and she doesn't really need a full introduction. But I'm here today to present on the Intellectual and Developmental Disabilities Ombuds Program, or what we're calling IDDO. I've been presenting at a couple of the DD councils, so if you've already heard this presentation, apologies, but we're trying to, get the word out. So we've been reaching out to all the DD councils. So my plan today is just to do some quick introductions. Then I'm going to talk to you about the Community Service Society, which is the organization that operates the Ombuds Program. Then I'm going to talk about what the Ombuds Program actually is, and then hopefully we'll have some time for questions and feedback. So again, my name is Rachel Schumann. I am the Training and Outreach Manager for IDDO. So a lot of my job is just getting the word out about the program and educating people on what we do. I also have two siblings on the autism spectrum. So, this work is both professionally and personally very important to me. Many members of our team, have family members who, have IDD. So I think it's important for us to, share that with folks so they know that we do know kind of where service providers, family members, and self advocates are, coming from. We have a sense of what the community, the folks that make up this community. Lynn, do you want to quickly introduce yourself before I?
Sure. For those who do not know me, my name is Lynn Decker. I'm a parent of two young men who have received services in the waiver since they were in their early grades, and who went to residential school. I have worked at JobPath as an MSc and as a day program without walls director. I was a support broker for a period of time, and then I worked as a ombuds person for a different program operated by Community Service Society called ICANN, where I helped people in MLTC plans and also people in the demonstration plan from Partners Health Plan.
Thanks,
And
Lynn.
now I am the QA manager at the IDD Ombuds Program. Thank you.
Yes, we're very lucky to have Lynn. She is a wealth of knowledge on the IDD system. So what is Community Service Society of New York, or CSS? We are a leading nonprofit. We've been around for over 100 years. And our main mission is to promote economic opportunities for New Yorkers. So we work to champion a more equitable city and state through direct services, advocacy, and research. And in my view, I think one, you can't have one without the other. If you're doing direct services, you're going to identify systemic issues that require advocacy. Research can inform both advocacy and direct services. So to kind of approach systemic issues from kind of three prongs, I think is very useful and needed. So what kind of direct assistance do we provide? So we have statewide live answer helplines where people can call and request assistance with kind of a variety of issues. We also have partnerships with about over 50 organizations across the state of New York, and our programs serve over 130,000 New Yorkers annually. And some of the issues that we help people with are enrolling them, helping them enroll in health insurance, um, helping them resolve medical debt, accessing the care that they need, giving them advice or helping them navigate student loans. So CSS kind of has a wide breadth of services that that it offers. So what is IDDO, or the Intellectual and Developmental Disabilities Ombuds Program? Look at our beautiful logo, or I think it's a beautiful logo. I'm biased. So I guess I like to start out by explaining what an ombudsman is. Many of you may already know what an ombudsman is, but some people, this is the first time they've ever heard that word. So the word ombudsman comes from the Swedish word for representative, and generally ombudsmans, advocate, mediate, educate, and refer. So there are all different types of ombudsmans. Like colleges and universities can have ombudsmans. Medical service providers can have ombudsmans. Government agencies can have ombudsmen. So it's kind of a general service. And so for many years, folks in the IDD community advocated for OPWDD to have an ombudsman, or to have ombudsman services that were available to individuals who were being served by the OPWDD system. And so in 2023, under the mental hygiene law, it was authorized, and OPWDD, was required to fund an organization to provide independent, conflict-free ombudsman services to assist individuals with intellectual and developmental disabilities and preserve their rights. So basically, the mission of this Ombuds program is to act as a resource and also advocate for individuals and families as they navigate OPWDD programs and services. So once the law was passed in 2023, OPWDD had to find an agency to build this ombuds program, because it's supposed to be independent, not within OPWDD. And so they put out, a request for proposals. Some organizations applied, and CSS was awarded the funding to build the ombudsman. And CSS has a lot of experience with ombudsman programs. So I think Lynn mentioned one of the programs, the Independent Consumer Advocacy Network, or ICANN. Other ombudsman programs that CSS oversees are Community Health Advocates, the Managed Care Consumer Assistance Program, or MCAP, and the Community Health Access to Addiction and Mental Health Care Project, or CHAMP. We don't have time to talk about all of these programs today, but if any of these are of interest, I'm happy to share additional resources after today's presentation, and I'm sure Brian and others in the DD Council can circulate them. So what exactly do we do, right? So a lot of this is very general, like what is, let's get down to the nitty gritty. What are we actually doing? So we're providing direct services to people with IDD, providers, family members, representatives, through our helpline. So I'm going to talk about our helpline, but essentially people can call or request assistance online or by email. And we can, sometimes it's a matter of just providing information and resources and kind of having a one-time interaction. Sometimes the person, or people who are experiencing the issue will have a more complex need and will need ongoing assistance. And so we call that casework, where they are assigned one staff person in our office that works with them to try to resolve whatever issue they're experiencing. The other things that we are doing are presentations like this one and attending community events. If any of you are attending the Include NYC Fair later this week, myself and I think another team member from our office will be there. So feel free to come by and say hello. And then in terms of policy, one of the things we will be doing is collecting data and trying to use that data to identify trends. So I'm sure all of you on this call are already aware with some of the challenges and barriers that people with IDD face when either trying to get onto OPWDD waiver or once they're on the waiver and trying to navigate and access different services. And so what we're hoping is that we can actually quantify, that information into actual data that can be shared with OPWDD. And that kind of sharing process and identifying systemic issues is known as a sentinel function. So we don't work completely alone. CSS often operates on a hub and spokes model. So just like a wheel has, the hub and, there's the sort of the core, and then there are the other supports that are the spokes. So CSS is the hub. We have engaged with parent and caregiver groups. We have regional outreach partners that are community-based organizations across the state. We're engaging with self-advocates, and we have a specialist. And so as the hub, CSS hired the staff, including me, to, be on the helpline, answer questions, provide casework or direct assistance to people. And then our spokes, we have a specialist called New York Lawyers for the Public Interest. They provide us with specialty training on topics that they have expertise in, and they also are providing us with legal referrals as needed. And then our regional outreach network is made up of community-based organizations and parent and caregiver groups, and that's across the state of New York. And just to be clear, our program is statewide. We are not just a New York City program. We are a statewide program. So how to get help? So the main way you can reach us is through our helpline. We're open Monday to Friday. We are staffed by counselors, attorneys, and then we also have 4 managers. So we have a new person starting. So once they start, we'll be 11 people in our team. So we're a relatively small but mighty operation. And our helpline, like I said, serves all of New York State. So that helpline number is 1-800-762-9290. And then we also have an email, iddo@cssny.org. And if you go to our landing page on the CSS website, you can also fill out an online intake form if that's your preference. And we do have at least 2 Spanish-speaking staff on the helpline regularly and 1 staff person who speaks Mandarin and Cantonese. And we also use a language line to provide interpretation for languages that, that our staff does not speak. So what exactly do we assist with? So I know that there was some discussion before about, organizations or resources for people that are trying to get onto OPWDD and the waiver and the front door process and get evaluations. This is a service that we can definitely assist people with. While the care coordination organizations are so important and are the ones that do submit those eligibility applications, we've seen, and I think many of you have seen, that sometimes especially if the person doesn't have all of their documentation in order that it can be really difficult for them to even access access that OPWDD eligibility in the first place. So we can definitely work with people to, you know, help them find help them find providers to do evaluations, make sure that they have the correct documentation explaining the eligibility criteria. I think, one thing that Lynn and I think many of us on the team talk about is that, there are very specific rules that OPWDD and New York State has around eligibility. And sometimes, like, we really need to educate people on, you know, exactly what they need, like making sure all their ducks are lined up in a row so that they can, have the most successful application possible. Other assistance we can provide is helping people explore their housing options and trying to mediate particular disputes. So we've seen kind of some issues where people maybe were hospitalized and then they're discharged, and then there's issues with them getting back into their housing, or finding housing that is going to meet their needs. So that's definitely a big issue that we've already come across. We're also here to answer questions about the role of CCOs and care managers. So sometimes people don't really understand, what is in scope for my care manager, what isn't in scope. We do want to encourage people to be proactive and really communicate with their care managers. And if their care managers aren't meeting their needs, they have the right to, to file grievances and things like that if they're really, have made every attempt to resolve the issue with their care manager. But hopefully it doesn't come to that, but we want people to be aware of what their rights are. Another huge issue that's coming up for us too is self-direction, and navigating that program, getting approval for different services like community classes under that program. So that's a big issue. And then as I mentioned, in the law, it says that we preserve, our duty is to preserve the rights of individuals with intellectual and developmental disabilities. So part of that is advising on the fair hearing process, their due process rights. And while we currently at this time can't provide legal representation, we can always connect people to a legal service provider if that is what's needed. So what services do we not provide? So as I mentioned, we're not here to perform the duties of CCOs and care managers. That's they play an important role, and we're not here to to be a substitute or to play that kind of role in a person's in a person's circle of support. We also don't assist with education, special education, or education based advocacy. So things like IEP meetings or advocacy around IEPs and Section 504 plans or other school-based services. There are plenty of organizations that do that work, and if someone does contact us with questions about that, we're happy to connect them with an available resource in their area. And then behavioral health. So we don't assist with access to early intervention services that would be provided under the Department of Health, such as ABA therapy. However, because of, how our organization is positioned, even if something is not within our scope, we do have a lot of other programs that may be able to help people, or community partners that can help people. So we're really well equipped to connect people with the appropriate resources if it's something that doesn't fall within our organization's scope. So one example would be, we're not necessarily processing Medicaid applications for people, but we do have a facilitated enroller contract for what's called ABD Medicaid, or Age Blind and Disabled Medicaid. And that, if someone is not already on Medicaid and that's kind of a barrier to getting OPWDD eligibility, we can connect them with one of the enrollers in that program and who can help them through that process. So, so we'll, even if it's not within scope, we'll do our best to connect people to the resources that they need. And that's it from me. You know, I don't, I haven't been able to look at the chat. So, I don't know if people are just making announcements or if there were questions.
So Lynn was posting a bunch of information on the program, which is good. Um, I think the biggest question I can just say that I had gotten in anticipation of you joining us and doing this, and it was perfect timing when you reached out. A lot of people didn't really understand, are they not going to their CCO? Are you replacing the CCO? Like that was some of the confusion, like where does your role fall in with the CCO still existing? So I'm hoping for people that this clarified it. Debbie has her hand up with a question.
Yes. This is question is because I've been asked by parents from other parts of the state. You said this is statewide, and I know you're based in New York City. So do you have any satellite offices, any in the other parts of the state?
Not currently, no. So we assist people primarily over the phone or by, you know, video chat or email or, you know, so
Okay.
we can assist people across the state. You know, we're operating with a pretty, you know, I wouldn't say low, but not, we don't have like, you know, all the funding in in the world.
Understand.
So I think you know, and we just launched, so we're a little over a month old too. So I think, you know, if there is an increased need, if we show OPWDD, oh, these services are really needed, and there's a need for in-person assistance or satellite offices, that could be something, you know, we advocate for in the future. But right now we're kind of in our pilot stage. So we're, you know, we've built this program, we've solidified our policies and procedures, our staff are trained and ready, and we're kind of just, you know, off to the races.
Well, I'm really glad you clarified that. I also want to tell you that the Community Service Society, I'm really glad you're with them. They're excellent. The CEO, David Jones, is a really open-minded, progressive person, and it totally, like when you ask him issues, whether it's for developmental disability or others, if he can't answer, he sends you to someone in his agency that can. So I'm really glad you're with them. Good luck. And my
Thank
son
you,
Christopher
Deborah.
says, good luck too. He couldn't be here today, but he sends his regards.
We should mention that we do have regional outreach partners, right? So at the beginning of this contract, the design of CSS's proposal put the focus on having the whole team together so that we can have high quality supervision and interactivity, because this is a new program. Some of CSS's other ombuds programs have grown over time and had some contracting organizations. So that would be so premature for us to make a promise that would happen in the future. But possibly if we were to grow, that would be a sensible pathway for us.
Thanks for the explanation, Lynn, but just letting you know that it's been asked by other families across the state. I'm just asking. I understand you're in the beginning stages, but I just want you to know that they've been asking us. So I'd rather ask the two of you than make up any question that I don't have I'd rather ask you guys. I didn't want to make up anything.
So we chose to have everybody work at one location.
Good.
So that we can have very high quality supervision of a growing team.
And I'm fine with that. I just wanted you to know they've asked me a lot of questions and I wouldn't give an answer that I didn't have. Good luck.
Oh, it's a great question, Deborah, and you're not the first person that's asked. So I think Rochelle, if I'm saying your name correctly, you had a question?
Yes, you are. Thank you so much. Most people don't. First of all, I want to thank you very much for that clarifying presentation. And I've been waiting for the start of this program for a couple of years now. So I'm really thrilled to see you get off the ground. It's a very particular question, which is that I work fairly closely with the CCO, And one of the challenges they face when they are trying to advocate for a member, let's say with a certified residential provider, is they can use persuasion, but they have no enforcement power. And so ultimately, if they fail to persuade, they fail to help. Do you have any more clout than the CCO would in terms of that kind
I
of
mean,
thing?
unfortunately, I think not at this point. I think we are working on building our relationship with OPWDD. They're going to be hiring a new director of advocacy. Um, I don't think currently anything in sort of our scope of responsibilities includes any kind of enforcement, but I think hopefully over time we can have, some influence over some of the policies that, OPWDD um, puts out there or makes changes to. But yeah, I don't want to I don't want to tell you, even though I would love to tell you that we have those capabilities. I wouldn't that wouldn't be an honest answer.
I appreciate your honesty. And I just had one other question, which is, I don't know if you've encountered this yet, probably not, but do you anticipate any issues if the complaint or concern is around the actions of a DDRO or an employee of a DDRO?
I mean, that's a good question. I don't and Lynn, you can chime in if you've seen differently, but I don't think we've had sort of like we've had issues where people are trying to get information from the DDRO and maybe aren't hearing back or like things like that, but I don't think we've had any sort of serious complaints or grievances made against the DDRO. So I guess to be seen. Lynn, unless, like I said, you've seen something that I haven't.
I think I can clarify that state operated facilities and services are not an excluded area for us, right? So people who have a concern with that, it's not that they can't call us. How we will map out the way that we bring those issues forward, whether that's through engagement with the DQI function or use of the objections to services process, where this is going to be a learning experience for all of us together. What vehicles are appropriate for what issues people are encountering.
Thanks so much.
The one thing that is carved out for us are the two CITs, Valley Ridge and Sunmount, because they already have an ombuds person.
Thank you, Lynn. Any other questions?
So there was a question in the chat, maybe I missed it if you answered it, if you can share the slides.
Oh, of course, of course.
So
Yeah.
if you want, you can send them to me and I can put them on our site for people to access or send them to our mailing list, whatever is easiest.
Yeah, no, that's I can definitely share the slides with you after this.
Thank you. All right, I don't see any other questions, but I'm so glad you reached out and did this because there were so many questions leading up to it of people who were just unclear on what it was and how to differentiate it from pre-existing services.
No, for sure. And, I think there was an announcement made from the commissioner on like a Friday afternoon, and we just got a flood of calls, and then people were like, "What is this?" So we've had to kind of reach out, pretty proactively to make sure that, people know, what this program is, what we can do, and that, again, like we're not here to replace the CCOs, but we are just, I guess, speaking of the CCOs, we are trying to meet with all of them so that we can, can develop partnerships with them. And also, if there are issues, we can identify people at the CCOs to escalate issues to if they do arise. So that's something we're in the process of doing now.
All right. Any last questions for Rachel or Lynn? All right. Again, thank you guys so much. Very informative. We appreciate you taking the time to come here and present it.
Oh, Brian, this is Pat.
Oh. Hi, Pat.
Hi, good morning. Pat Liu, Family Support Coordinator. This is a Family Support Coordinator from GHO. So I have a question for Rachel. I don't know if I missed anything at the very beginning. So do the family need to have any kind of eligibility or pre-requirement document in order to get a service from you guys?
No, so as long as they're coming to us with an issue, like whether it's like, I need help obtaining eligibility or, you know, I already have eligibility. But if the person doesn't have eligibility yet and it, is at the very, very beginning of the process, that's definitely within our scope still. Oh, Pat, you're
If
muted.
someone already have the eligibility, they have issue or concern need extra assistance from, they already have CCO. So can they also reach out to you?
Yeah, so I think with the CCO, like what we'll first tell people is like, did you reach out to your CCO care manager about this? Will be kind of our first question. So definitely we encourage people to first try to troubleshoot whatever issue they're having with their CCO. But sometimes, we found like, for example, like with self-direction and like community classes, our supervising attorney, she herself has a child who is receiving self-direction through OPWDD. And so she actually has experience with, working with the fiscal intermediary, appealing decisions about community classes. So not all the care managers might have that experience or that wealth of knowledge. So, they might reach out to their care manager who can maybe, give them the sort of basic rules and information around that, but they might not have the capacity or knowledge to really like, fight a decision from an FI about a community class. Whereas like our organization, we are set up to assist people with that. So, I think, I think I don't want to discourage people from reaching out to us, but I will say that we do, we, as part of our intake process, we would ask them, have you talked to your CCO care manager? What steps have you taken to try to resolve this issue?
Great, thank you.
Thanks, Pat. Any other questions? All right, I don't see any. Thank you guys again. And if I do get any, I'll forward them over to you and let you guys know. All right, so we are gonna move on to announcements. So again, I always recommend put them in the chat as well because the chat gets posted. And then I'll go by hands I see. I just have to make a quick one. Someone reached out to me that they couldn't attend the meeting today, so let me just not forget it. Give me 1 second. So, okay. Uniquely Me Creative Arts. I sent some emails about events they have going on, but they're doing Financial February, and they have a big event coming up on February 8th from 10 to 12 at the Bethany Baptist Church, where you can learn more about Medicaid support, guardianship, special needs trusts, home health care, reimbursements, and more. There will also be children's sensory stations on the 3rd floor, and you can meet, they're having a panelist with Assembly Member Zinnerman, Deborah Greif, Audra Barrow, Tanette Williams, Amanda Weiss, Jonathan Saul, and Evan Yankee, who's an advocacy director. So this should be a really good event to help people get information on support, guardianships, bunch of legal advice, things like that for people with IDD. I will send out the flyer if I didn't already. And the first hand I saw was Doris.
Hi, everyone. My name is Doris Kahn, and I'm the Outreach Coordinator for New York State Institute on Disability. We're a family support agency, and we provide the following. We have evaluations for individuals who are seeking OPWDD eligibility and they do not have Medicaid. They can contact Elizabeth Sunshine at 917-699-0578 or email her at esunshine@nicidinc.org. NICID also provides behavior management services under the direction of Juliet Hawkins. You can contact her at 917-524-4856, or her email is jhawkins@nicidinc.org. She serves individuals and their families that live in Brooklyn, Queens, and the Bronx. We also provide reimbursement for individuals living within the 5 boroughs. Contact Jackie Tripodi at 929-202-1115 or email her at jtripodi@nicidinc.org. NICID also provides free transportation in the Bronx, Brooklyn, and Staten Island for individuals who have OPWDD eligibility and they need transportation for doctor's appointments or recreational outings. You cannot, individuals who have self-direction are not eligible for this service. Contact Joe O'Grady at joeogrady@nicidinc.org, or his phone number is 917-747-9425. 4, we also have tickets for recreational outings for individuals who live at home with in Brooklyn, Queens, and Staten Island. If you have self-direction services, you're not eligible for these recreational outing tickets. Contact Sarah Alton at 718-494-6457 or salton@nicidinc.org. Thank you. All the numbers are posted in the chat. I attached a flyer in the chat, Brian. Thank you.
Thank you, Doris. And I also just want to point out, I missed this in the chat earlier. Our representative from DOHMH, Rihanna McKenzie, had posted that they contract with 5 providers throughout the boroughs to provide free evaluations to individuals without Medicaid and who are underinsured. And that goes back to the evaluation conversation from earlier. Carrie.
Hope everyone's having a good Monday and enjoying the relative warmth of the day. So next week is an incredibly busy week for inclusive services. On Monday, we are pleased and honored to host a book launch party for the book Safe Harbor by Padma Venkatraman. This is a middle grade book that has interest for older students, older youth who are reading at, say, a 3rd grade level. So we're doing that. We're having a book launch party and conversation with her at the Central Library on Monday from 5 to 7. There will also be free books and a book signing afterwards. The details for all of these things are in the chat. Then on Wednesday, we have our one-to-one assistance navigating disability systems that we do with Include NYC each month. And that's a virtual program. So people call and make an appointment and talk with the senior family educator, Ruth DeRoma, on the phone. Then on Friday, we have our monthly developmental disability resource fair at the Greenpoint Library this time. We're very excited. We have I think we have 16 exhibitors there. Some of you will be there. This is the fair at Greenpoint is traditionally our busiest fair in the 2.5 years we've been doing these monthly fairs. And of course, it's in partnership with the Brooklyn Family Support Services Advisory Council. Deborah, don't forget to tell Chris that I mentioned it and put it in the chat.
I promise.
Thank you. And then, so that's Friday, and then Saturday, Area 9 Saxophone Quartet will be providing a free sensory and autism-friendly concert at the Brooklyn Heights Library at 1 o'clock. So that's all of those things are in the chat. And I just also want to remind people that the Include NYC Resource Fair is back in person this year. And it will be at the Shed. I put the information for that in the chat. And of course, their focus is on youth ages birth to 23. And they, of course, they have people there will also have resources for older adults. not older adults as in senior citizens, but people older than 23. Sorry. So that's also in the chat. And yeah, I think that's it for me, but it's going to be a great week next week. And then all the staff here are just going to absolutely collapse. So thank you. And we hope to see you at one of those things next week, if not all of them. It's going to be a lot of fun. Questions?
Thank you, Carrie.
Thank you.
Any other announcements anyone wants to make?
Brian, could I add on one thing? I forgot to say that the one-to-one navigating disability systems and is available in a variety of languages. And by request, we can have interpreters at the other events. Thanks.
All right, thank you. Lynn?
Sorry, I gotta find that unmute button. I put in the chat a link to register for Westchester Institute for Human Development's Transition Institute, which is Wednesday, Thursday, Friday of this week. There is some very good programming and presentation in that conference. It's free, it's virtual. If you can't make a session that you are interested in, their videos from the conference get posted later. And you can also see the sessions from prior years. So good quality programming that they put on, free, virtual, later this week.
Excellent, thank you. All right, I don't see any other hands or any other announcements. But again, this is recorded. It will be posted on the site either today or tomorrow. The chat will be posted along with it. So you'll see all the links and information people provided. So again, thank you to our two presenters. And thank you to everyone else that participated in today's meeting. Keep an eye on your email. I do send plenty throughout the week. Talk to everyone next month.
Yes, you send great emails. You and Chris
Thank
are
you, Debbie.
tied.
Appreciate that.
Not a problem. Thank you.
Have a great week, everyone.
Have a good day,
You
everyone.
too.
Thank you.
Bye, everybody.
Bye-bye.
Thank you.
Bye.